form, and I have no idea unless you wildly applaud or throw things at me what you think of my presentation. Anyway, welcome. My name is Claude Stram. I'm a member of the faculty here at Joseph Bell School of International Studies. I presume most of you know that. I'm the director on the Center on Rights Development. I also direct the Human Trafficking Center and the International Human Rights Degree Program. So what I'd like to do is just say a couple words about CORD, and I will introduce the speakers, although you can read their bios in the handout, but doing it not because for your benefit, but for the benefit of our taping and for others who might like to hear this program at another time. So the Center on Rights Development is actually the oldest center at the Joseph Bell School. It was started some 20 years ago. My colleague who was here last night, we know as Peter Van Arsdale. PVA, as students tend to know him. When I first heard about PVA, I kept on thinking it was some kind of plastic tubing, I couldn't figure out who this person was. So not only is he my predecessor in running CORD and directing CORD, but he is also the person who was the founding director of the Humanitarian Assistance Program. And so even though he's not here, I want to again thank him for the work he's done over the decades. He's now semi-retired, which means he's here what he feels like, and the rest of the time, like recently he was hanging around in Antarctica. Of course, that's what you do when you're a retired professor, I guess. So CORD focuses on different themes each year, and we have decided a few years ago to look at the International Bill of Rights and to use one of those documents. Universal Declaration of Human Rights is well known, been written about extensively. The ICCPR has also a well-known document, and people have to reflect on it. The United States is often in conflict with it. And then there's this third document that little is known about, little written about or understood, the ICE-SCR, which is International Covenant on Economic, Social, and Cultural Rights. And so we decided to use that document as our base document and to look within that document for themes that we can then work on. So the past few years we did things like, I think last year it was the right to education, before that the right to water, and other thematic topics that we have used to build a knowledge base around that document. This year we made the decision to focus in on the right to health. And so we've done numerous talks, lectures, gatherings during the year, and it pushes us to our annual spring symposium. And this year, as you know, is entitled Complex Care, the Right to Health in Emergency Settings. Last night we were fortunate to have it open by my dear old friend and colleague, Dr. Chiara Lapora, who has been with MSF for a very long time and now in charge of the Middle East region. She was also Professor Hen Rice's predecessor running the Humanitarian Assistance Program here at the Bell School. Today, tomorrow, and Saturday, we have a series of really wonderful panels. I hope that you will find the time to attend as many of them as possible. So let me simply introduce our panelists today, and then I'll ask Lynette, the Associate Director of CORD, then to moderate the Q&A as much as that is necessary. I will, forgive me, read the bios for the benefit of our taping, and we will start. So we'll begin with Dr. Christine Moe, who currently teaches at the Rawlings School of Public Health at Emory University, while serving as the director for the Center for Global Safe Water at Emory University as well. She received her PhD from the Department of Environmental Sciences and Engineering at the University of North Carolina in 1989. She has served as a consultant in water issues, supplies, health, and treatment for many different companies and organizations, both local and international, since 1991. In 2007, she served as a consultant for the Bill and Melinda Gates Foundation, advising on sanitation research needs. She has received many awards, including Food Safety Leadership Award in Research Advancement from the NSF International in 2008, and the Infrastructure Award, where her project pro-poor sanitation demand creation in Bolivia was chosen by the World Bank staff from 118 finalists in 2006 Development Marketplace Global Competition. Her interests include global health, infectious disease, and safe water. She's a member of the American Society for Microbiology, International Water Association, and the American Society of Tropical Medicine and Hygiene. Sam Stevens from Global Soap Project has been at the helm of the Global Soap Project since February 2012 and came to the organization with an extensive background in international nonprofit leadership, development, and consulting. He worked for several years as a senior nonprofit consultant, serving as a strategic planning and development advisor to nonprofit organizations around the world. During that time, he also served as an adjunct professor of management at Virginia Tech. He also led development, communications, and volunteer and senior service programming as vice president of external relations for Volunteers of America in Salt Lake City. Additionally, he served in Washington, D.C. as director at Beyond Borders, a human rights organization, and then as executive director at ICSF, a capacity building organization. Sam has an MBA in international management and is also a licensed pilot. Did you fly yourself here?
I wish.
Oh, okay. I was just curious because we paid for your plane ticket, so we wanted to make sure that we're getting.
I appreciate that. Exactly. You're safe this time around.
Okay, good. He has had the privilege of serving on boards of directors for more than a dozen nonprofit organizations. That's far more than I would ever dream of doing. That's too many. I want to. We just talk afterwards, Sam. That's really over the top. And has worked and traveled extensively in more than 50 countries worldwide. Please join me in welcoming our speakers for today. Sit right there. How's that?
All right.
Unless you want to come up here.
Well, I don't have a long enough arm.
So you can relax that way.
All right. And is this on? Can you hear me all right?
We can move it closer.
We can move it closer to you for while you're talking.
Okay.
How's that?
Good. Well, thank you so much for inviting me to be here. This is fun. It's the first time I've been in Denver with snow, so it was quite a change from 80 degrees in Atlanta yesterday. But I'm taking lots of pictures because it's so pretty. Thank you for the warm welcome, and also thanks to the organizers. You guys are amazing, so I appreciate being here. So I'm going to start off by talking a bit about the big WASH picture. And the term WASH, we use a lot, but you might not be familiar with that. It means water, sanitation, and hygiene. And sometimes if you say WASH, it means water, sanitation, hygiene, and health. So there's a little bit, I don't know how you find this, there's a little bit of debate about whether the H is hygiene or health or both, but I just want to make sure that all of those are on the table here. All right. So looking overall across the world, here are some statistics to sort of set the stage. That if we look at the water problem, it's about 180 million people who don't have access to improved water supplies as defined by WHO, UNICEF, that are doing the monitoring of this. It's important to realize that improved water supply doesn't mean safe water supply. So there's actually more people worldwide who don't have access to safe water. If you look at the sanitation picture, this is even more serious or more grim. So it's about 2.6 billion people, or roughly 40% of the world's population, that don't have access to basic sanitation. And the consequences of that are huge. If you just think about schools, it's about half of the school children in the world go to a school without a toilet. So the consequences of that on girls, especially as they go into adolescence, they tend to drop out of school if there isn't privacy for sanitation and for menstrual hygiene management. So just a simple thing like a toilet in a school has huge consequences. And then let's think about the health consequences of this. So it's hard to really estimate the total health impact of this, but roughly it's about 1.8, 1.9 million deaths of diarrhea per year in children under 5. That's the most vulnerable group. It's estimated that about 80–90% of these deaths are due to poor water, sanitation, and hygiene. Usually we think of this as about 5,000 children per day dying from diseases related to poor water, sanitation, and hygiene. I think that some of the recent estimates are lower than that, but that's something, just sort of a ballpark figure to keep in your head. And there's also a silent health impact, and that's the worm infections. So that doesn't cause diarrhea, but it can cause stunting in growth, and it can also cause impaired cognitive development from these worm infections. So that's really hard to measure, but if you have children who aren't able to think as well, aren't able to learn as well, what's the long-term impact of that for the economy and the development of a country? So I call that sort of the silent health impact. We don't have a good way to measure. The other important part of the problem is water scarcity. And I see this as something that is received more attention recently, and I think when I look at all of you and your age range, this is going to be the defining issue in your future. Is there enough water for everybody? How do we use that water? The number of water scarce and water stressed countries is projected to increase, as you see here, and the population that live in those countries is projected to increase. And the implications of this for peace, for food security, because most of our water is used for agricultural purposes. This has great impact on health, food security, and world relations and peace. And then, because we are thinking about humanitarian rights, I also wanted to mention water and sanitation as a human right. In 2010, so not that long ago, the United Nations Human Rights Council passed a resolution that affirmed that water and sanitation are human rights. This is General Comment 15. The human right to water entitles everyone to sufficient, so that's quantity, safe is quality, acceptable, physically accessible, and affordable water for personal and domestic uses. So this was a major step in terms of affirming water and sanitation as a human right. But it has a lot of implications. If you say that this is a human right, what are governments responsible for? What are individuals responsible for? You know, if there's access, what's the individual responsibility to use that infrastructure? Who defines affordability? You know, this is the term affordability, but who defines that? And what is the role of private business versus government and market-based approaches to provide water and sanitation services? So just a few things to think about. And then the big issue is how can we create, promote, enable provision of safe water and sanitation at scale? Not just pilot projects in one community, in one neighborhood, but how do we take it up to scale? You know, how do you provide sanitation for 40% of the world's population? That's a huge challenge. So I want to tell you a little bit about our Center for Global Safe Water. Dina, where are you, Dina? Dina said that I could do this, so I just wanted to get a plug for what we do. And our center is a consortium, so I'm at Emory University, which is very similar, I think, to your university. It's a private university, about 10,000 students, both professional schools, graduate school, and undergrads. But we have a sister or brother university. This is the Georgia Tech, Georgia Institute of Technology. That's where the engineering school and architecture, atmospheric and earth sciences, public policy. Emory mainly in public health, but also medicine, law, business. So these two universities have complementary skills. Then we have the Center for Disease Control, which is right across the street, and they have a number of groups that work on water, sanitation, and hygiene, and these are some of the different sections of the CDC. The NGO CARE is one of the biggest NGOs working in the sector of water, sanitation, and hygiene, and they are based in Atlanta. And then the Carter Center is based in Atlanta, and they have programs in health, specifically trachoma, guinea worm, river blindness. Can't pronounce that today. River blindness, also malaria. So all of these are related to water, sanitation, and hygiene. So these are the groups that are in our consortium, and we have our founder, Jean Gancarosa, realized that we have all these groups in Atlanta working on different aspects of water, sanitation, and hygiene. We'll have to add the Global Soap Project to the consortium. And he said, let's form a center and see how we can work together. And our mission is to promote or improve global access to safe drinking water and hygiene, with a special emphasis on vulnerable populations in developing countries. We have three main areas of focus. We do applied research, and I'm going to talk to you about one of our projects, and evaluation. We do training and capacity building, both for our students at Emory, but also with our partners in the field. And we always work with local partners. So we have local and international NGOs, academic institutions, and government. What do we do? Well, these are pictures of some of our research staff all around the world. Up at the top, Caroline is demonstrating a hand washing station in a refugee camp in Malawi. Ali Huttinger here is working on water treatment devices in health centers in Rwanda. Will Oswald and I were looking at how do you make sanitary hardware with fiberglass in the highlands of Bolivia. Over there, David Berendis is taking water samples in Rwanda. And Mia, Lenore, and Kate were about to go do an evaluation of water, sanitation, and hygiene in 6 hospitals in Ghana. So we do a variety of work, different countries overseas, as well as research projects in the US. And how do we work in developing countries? I thought this may be of interest to you because of your global focus. We tend to have multidisciplinary teams on our projects because water, sanitation, and hygiene is really a multidisciplinary problem. So we have teams of faculty, staff, and students. We often have staff living in our country where we're working and students coming for summer internships. We work, as I said, in close partnership with local NGOs, academic institutions, and government. We conduct our research in country or monitoring and evaluation projects, and we work very hard to disseminate our findings, both locally in country as well as internationally. We have a bunch of different research foci: neglected tropical diseases, wash in schools, menstrual hygiene management, wash in healthcare facilities, wash in slums, field trials of different interventions and technologies, urban and rural sanitation approaches for low-income settings, how are infectious agents, diarrhea-causing agents, how are they transmitted through poor water, sanitation, and hygiene, rapid tools for assessing fecal contamination. I won't go through the whole list, but just to give you an idea of some of the different research topics that are involved here. I'm going to focus on wash in slums, and I know this is not refugee camps, but I would argue that wash in slums, that slums are sort of a chronic crisis, and it's a huge problem that has been under-recognized and understudied. So if you will give me the leeway to focus on that, I hope that you'll find this interesting. So here's some of the rationale for this, is that you've probably heard that in 2008, the balance of population in the world tipped for the first time in the history, our global history, to more people living in urban areas than rural areas. And I think this has a lot of implications for development. The UN is predicting that by 2050, not that far away, 65% of the global population will live in cities. Most of the urban growth is occurring in developing countries, and this is especially true in sub-Saharan Africa. And I really like this graphic here. This is from The Economist a few years ago. Look at the projected growth in these cities in sub-Saharan Africa. This is huge. And even though the overall proportion of the population living in slums is declining, the number of people living in slums is actually increasing. So here, this is coming from, if you're interested in this, this is a great publication that you can get on the internet. It's called Hidden Cities, Unmasking and Overcoming Health Inequities in Urban Settings. It's put out by WHO and UN Habitat. And here they show that the proportion, if you look from 1990 to 2010, in developing regions, the proportion of people living in slums is decreasing, but if you look in absolute numbers, it's going up. And if you look at water access in slums across the regions, Africa, Americas, and Asia, it's not that impressive. You know, it's about 45% or even less. And I want to emphasize that access does not mean 24/7 water services. In fact, most of the time in cities and developing countries, you don't have water running through the pipes 24/7. And it doesn't mean safe water. So I'm going to show you some data from Accra, Ghana that illustrates this. The other thing to note is that in many parts of the world, especially in sub-Saharan Africa, there's negative progress in terms of providing drinking water coverage. And in Vellore, India, where we have a study, we were trying to collect a water sample from the municipal water system, and we were having trouble because they were only getting water maybe once every 14 days in our study neighborhood. So we could barely collect a water sample to assess the quality. So let's talk some more about the slum environment. And slums are really complex environments. You know, you see them from the air or from a higher place, and it looks pretty bad. And then you get down on the ground and look around, and you realize that these are very complex. So you have crowded populations. No surprise, you guys knew that slums were crowded. But something else that happens is that you have a blurring of private and public spaces. So you think about how we live our lives, how we cook our meals, where do we go to the bathroom, where do we take a shower. That happens in a private space in our houses. But in these neighborhoods, a lot of those activities happen right in the street. So there's a blurring of what happens in the public and private space. That means that there's communal exposure. So what your neighbor does affects you. If your neighbor shits right there in front of the house or in the drain in front of his house, that can come into your house on your feet. Your children can be playing in it. So there's this real impact of communal exposure that can lead to disease transmission. So very complex environments. Also, this rapid growth has outpaced the ability of governments to provide infrastructure. And a lot of times, I mean, wash infrastructure, piped water, sanitation. And a lot of times these neighborhoods would be considered illegal. So the government can say, well, we don't even have to provide infrastructure because these aren't legal settlements. Sometimes you don't even see them on the map. There could be communities of tens of thousands of people that will not be on a map of a city because it's illegal. How do we provide wash services to these neighborhoods? It's very difficult to go in and retrofit typical piped water, piped sewage because there's so little space. So even though you have an economy of scale, because you have a lot of people living together, it's very hard to dig up and put in traditional pipes. The other thing to think about, are you familiar with the Millennium Development Goals? Is that something everybody knows? Great. So Millennium Development Goal number 7 focuses on water and sanitation. And a lot of the concern has been providing access to rural neighborhoods, rural communities. And a lot of NGOs have focused on rural communities because traditionally they have lagged behind in getting access. But as I argued before, access in an urban community doesn't necessarily mean safe water or 24/7 water availability. And where is there the greater risk of disease? I would argue that it's in these urban neighborhoods. And so here's some data on this, again from this great source, Hidden Cities, that we really don't know what's driving child mortality in these slums. So here's data on under 5 mortality rates in urban areas for Africa, Americas, and Asia. And if you just focus on this light blue bar, that's the lower 20th percentile, the poorest of the poor. And you see here that the child mortality rate in sub-Saharan Africa is much higher than it is in the urban poor in the Americas and Asia. So what's driving that? And I can tell you, as someone who spent time on the ground in the slums in Africa and in Asia, it's not apparent why there would be differences in this child mortality, because on the ground, all of these slums look equally terrible. So there's a lot more that we need to understand here. How many of you have seen the F diagram before? Okay, so a few people. But this is the idea that if you have poor sanitation, you get shit moving everywhere. And excuse me, but in our world, we don't mince words. We talk a lot about shit and toilets because this is the reality of what we're working with. So you have human shit moving into, by flies, soil. I was at another meeting in Australia last week where I had to sort of watch my language more, but more international audience, but I think with you guys we can have plain talk, right? So flies, open defecation, soil, going into surface waters through open drains, going into groundwater through leaky latrines, pit latrines. We also have animals and animal excreta, which also poses a health threat. From here, where does it go? It can go directly onto hands, and probably Sam's going to talk about that. From hands to food, from hands to drinking water, but also contamination directly of food from flies and soil, and from drinking water, from surface water and groundwater, back to humans. The take-home message here is that there's many potential exposure pathways or disease transmission pathways. So this is my notorious octopus slide that I show my students. So I always say, remember the octopus slide. If you've got all of these tentacles of disease transmission, how many of them do you have to cut before you see an impact on health? And this is one of the big questions that we are wrestling with in this sector. So now I'm going to tell you a little bit about WASH in Slums research project that we've been doing in Ghana. It's called the SaniPath study because it's talking about pathways of exposure to fecal contamination or sanitation pathways. It was funded by the Bill and Melinda Gates Foundation for 3.5 years, and we're just on the tail end of this study. It involved a lot of different collaborators. So let's take a look at a typical city in a developing country in sub-Saharan Africa. Here's a city of about 4 million people. There is no functional wastewater treatment plant in the whole city, okay? No municipal wastewater treatment plant in the whole city. What happens is you get these tanker trucks that go and suck up the shit from public latrines, from septic tanks, from household latrines, and they dump it right into the ocean at one point. It's euphemistically called Lavender Hill. So in a typical day, you will see about 60 or 70 of these tanker trucks going around the city and coming and dumping 3 at a time, 5 at a time, all at this one place, right into the ocean. In every part of the city, you will see open drains of all sizes along every street and alleyway. And children can get into those, and these things will, when there's heavy rainfall, they will flood, and the shit will move everywhere. So this is the reality of what sanitation looks like in Accra. There's a heavy reliance on public latrines. There's also a lot of open defecation. And they're flying toilets, which is when people defecate into a plastic bag, tie it up, and then toss it. They're also called, in Accra, they're called takeaways. So our project was trying to ask this question of when you've got flooding and open drains and public latrines and ocean dumping of sludge and children with exposure to the household and nurseries and primary schools. And I'll talk about the impact of this on food because these open drains are also used to irrigate crops in urban agriculture. When you've got all of these potential pathways, what poses the greatest risk in these low-income environments, and how should governments or NGOs prioritize how they spend their efforts and their money? So this is quickly, we had these 4 neighborhoods, 2 were on the beach, 2 were inland, and what we did is, this was a multidisciplinary study. We were looking at all of these different pathways, beaches, drinking water, open drains and flooding, urban agriculture that used wastewater irrigation, schools and nurseries because that's where children spent their time, public latrines and households. We collected a lot of data on human behavior. What do the people in these neighborhoods actually do, especially children under 5? You know, how is the life of a young child under 5 in Accra, in a slum neighborhood? What does that look like compared to the life of a young child here, for example? So we used a lot of different methods to collect the data on behavior. And then we also went and took samples of everything. Soil, we swabbed public latrines, we rinsed people's hands, we took samples of produce that was grown in the city, and we tested it for fecal contamination. So I'm just going to show you a few results that show what these neighborhoods are like. So we did household surveys of 800 households, 200 in each of these neighborhoods. You see that most of these households have children under 5. Most of these people have little or no formal education. There was a mix of Christian and Muslim. Tenancy, who owns their house? You know that in slums, a lot of people don't own their house. They are squatters or renters. So tenancy is a big problem. In some places, only 8% or 2% of the people own, sorry, wrong column. In some cases, it was maybe 50%. In other cases, it was 80% of the people own their home. And the part that I want to also show you is sanitation facility in their home. The best we saw was that 58% of the households in the wealthier of the 4 poor neighborhoods owned a toilet or had some sort of sanitation facility. And the worst we saw was that 1% of the households had a sanitation facility. So for that neighborhood, what are they doing? Where is all the shit going? So I'm just going to show a few key things that you might wonder about. What about drinking water? Okay, so there is piped drinking water, and it can look like this. Can you see that in the back? So these are pipes running on the surface, sometimes running in ditches of wastewater. The power goes out several times a week, if not every day. When the power goes out, you lose the pressure in the pipes. You can have intrusion or contaminants entering the pipes. 70% of the households use sachet water, which is like bottled water but in plastic bags. It's cheaper than putting it in a bottle. Ironically, in the poorest neighborhood, they were spending the most money on this sachet water. And many households also store water in the household because there's this intermittent supply, yeah? If you don't know when the water is going to go out, you store it. So just looking at some of the microbiology, and I know this is a lot of data, but let's just look at the bottom line. The piped water didn't have chlorine, didn't meet WHO standards for chlorine. Most of the water that was stored in the household had high levels of fecal contamination. The sachet water was pretty clean, but people are having to buy that every day, and it can get covered with dirt on the outside, which is a problem. So we saw variable levels of contamination, but the highest level of contamination was in the stored water in the household, what people are actually drinking. The other things we looked at in the household, we sampled soil, we did swabs of the surfaces, and these households had a lot of contamination in them. So right there where the child is spending their time, when we sampled for fecal contamination, we were finding high levels of fecal contamination. We looked at the drains, and we found out that although it's rare, children do have contact with the drains, like if their soccer ball falls into the drain or some toy, they will go in and pick that out. That there were a lot of those flying toilets or takeaways in the drains. There was also just open defecation directly into the drain. And when there was flooding, this drain water would overflow into the private and public space and move the contamination around. When we tested the water in the drains, it was like raw sewage, so that's no surprise. This is just open wastewater as well as drainage water, and the contamination levels were very high. And this is interesting because it shows what a problem flooding is. So in our lives, I don't know how often you are exposed to flooding, but in these slum neighborhoods, there are 35% of our survey respondents said that their neighborhood or their compound, their household had flooded in the past year. And in some neighborhoods, most of the neighborhood was in a flood zone. So flooding is a big problem in terms of moving fecal contamination around. Just a word about the urban agriculture, because for us this was new territory. You know, we were thinking about drinking water and toilets, and then we realized that there's all this urban agriculture going on in sub-Saharan Africa. Not just in Accra, but in many cities in sub-Saharan Africa. What are they planting? They're planting some leafy greens and tomatoes and peppers,